So Janet, you're here today 4 weeks after I did an injection on you. And it's a very exciting injection, and that's why we're doing the video. In fact, I think it's one of my first videos, even though I've done this procedure many times, but as I told you, you're such a perfect video candidate because you have such an interesting story.
Yeah.
So you came, well, unfortunate, interesting story.
Yeah.
So you came to me after you had unsuccessful foot surgery in Orlando, not
Yes.
with me.
Mm-hmm.
Okay. And basically you had severe pain on the bottom of your foot and you lost 80% of the padding. You had screws and plates put in. How long were you like off your foot after that surgery?
8 weeks.
8 weeks. So it was like a big ordeal, and
Yeah.
you go through all this and then you are almost worse off than you were before. So luckily we injected Liposana on the bottom of your foot, and I'm going to show in the video. So basically you had like almost no padding here. I could see the bones literally almost coming through the bottom of your foot.
Mm-hmm.
And I said, oh my God, we have a beautiful solution for you. So we did it 4 weeks ago. So tell me, how much better are you today versus 4 weeks ago?
1,000%.
Okay.
I can walk. I'm not in pain 24/7.
Okay.
It feels almost normal.
Almost normal. I mean, now we're talking about fixing some little things on your foot, which hopefully will not require screws and plates. But I'm going to actually show the viewers your ultrasound. And I know it's kind of hard to see, but we actually measured the thickness of your plantar plate, and basically we measured the thickness between the skin and the second metatarsal, and before it was 2 millimeters, and today you were 9.4.
It's a miracle.
It's a miracle, right? So
Mm-hmm.
like basically 9.4, 10 is normal, so we're all like with 94%. So obviously for people who are suffering with something like this, and remember, like, first thing you told me, no more surgery. And I said, no, like, I would never do surgery on you, right? I think it would be such a viable option, right? Don't you agree?
I agree.
Right.
It's been perfect.
It's been real, well, I mean, just looking at the bottom of your foot, that's amazing because that was not there, right? Like,
Yeah, you could see exactly where the bones were, and it was so painful.
Right. Well, congratulations. I'm so happy. You just made my day.
Thank you. You made my day.